My name is Edgar Khan, and I'm the founder and creator of Time Banking, which incidentally has now spread to 34 countries. And it's very exciting to see that people are really finding who they are and how they can contribute. A time bank is a new kind of extended family where we ask people what they can do. We've yet to find a person who can't do 15 or 20 things that they don't put on their resume. And so once you put that database together, you all of a sudden have a new wealth of capacity. And for every hour that you give using some of those skills or capacities to help somebody else, you get a credit, and then they owe it to somebody else to pay it forward to return the favor. It's not a legally enforceable obligation, it's a moral obligation. The Internal Revenue Service does not acknowledge the existence of moral obligation, so this is not taxable because they can't tax something that doesn't exist. And what we're seeing is that hundreds of thousands of hours are being generated of people helping each other. There's vast untapped capacity. There's also vast unmet needs, and the question is, how do we put the two together? And I think a medium of exchange that honors every human being for what they can do sends a message of respect, and that sense of mattering, of being valued for who you are and what you can do, is something we all need, because I think we all need to feel we matter. I saw a 94-year-old woman who earned time credits because she brought in a joke into the HMO office each and every day. I saw somebody who was suicidal. A Time Bank member came to him, and the Time Bank member played such bad solitaire that it drove the guy crazy, so he started helping the guy. Then they started poker playing. Then they became the crack poker playing team, and they went from place to place to place, so that you're never quite sure what's going to happen. I've seen people who were labeled hypochondriacs saying, "I'm too busy to see the doctor today, I need to help somebody." So it's just remarkable, just the range of things people can do and don't appreciate how important they are to others. It's very creative, and I think the other thing is it's not just about individual transactions. Those transactions turn into relationships. The relationships turn into networks, and the networks begin to reweave community. And we're so used to feeling that we have to do it ourselves, that to ask for help is somehow forbidden. And I think what this is saying is, no, we need a new social etiquette that makes it permissible and safe to say, I need some help. We're seeing 2 new time banks a week growing up in the country, and it is spreading as we're discovering that maybe money wasn't what we thought it was, and maybe we need to do some things ourselves that we can only outsource being a human being, but so much. I think this is a pioneering effort that in fact can change our whole approach to healthcare. We're beginning to understand that just building more hospitals doesn't promote health, that even delivering more care alone will not produce more health, that we need an active partnership between community and professionals and agencies. I'm clear that this can make a difference in people's lives.